Hello and welcome back to the Modern Pain Physician. I'm your host, Dr. Kent. I'm a board-certified interventional pain doctor here in Bend, Oregon. And today I'd like to talk to you about GLP-1 medications and back pain. These GLP-1 medications have exploded onto the scene as this kind of fantastic way to lose weight, but there are risks when taking these medications, even from a back pain perspective. And so these medications, essentially what they do is they make it so you don't eat as much. What happens when you don't eat as much is your body goes into starvation mode. And what that does is your body starts metabolizing, eating up all that fat and using it to energy, and people shed a lot of weight and a lot of fat. But what also happens is your body doesn't necessarily differentiate between fat and, say, muscle. And it also eats up the muscle, to help basically continue to bring energy to the body and support the brain. But you do need muscle to support the skeleton, your body, your ability to stand, your ability to walk for any length of time. You have to have strong muscles in your back to allow you to do this. And so if being on these medications, you're able to lose weight, at a certain point, that'll help kind of offset the load on your body, help with your knees, your hips, even your back muscles to a certain degree. But if you start losing too much muscle mass, then people start recognizing that they still have back pain. And so losing weight, hundreds of pounds, they may still have back pain. And so when you're on these drugs, it is imperative to do two things. One, you gotta eat right. You still have to eat. And a lot of that food that you eat has to be nutritious, so it has to be high quality food, and it has to be high in protein. And that is, again, to help replace the protein that your body is going to be using to help support, the energy. And so you need to continue to eat solid protein and eat a nutritious diet to help support basically all the structures in your body. The second thing that you need to do is you need to continue to exercise. Exercise to continue to maintain the muscle mass. So exercise with the protein intake will help support the muscles. Because if you avoid exercise, you don't take in enough protein, what will happen is you will lose a lot of muscle mass, essentially as your body is starving. And so it's imperative that you basically integrate the good nutrition and the exercise into your routine when you're on these drugs. If you continue to have back pain and you're on these medications and you're losing weight, there are things that can be done other than exercise to help with back pain. And so the first thing that I would tell folks is that exercise physical therapy. And so basically what you're going to be working on are what are called your multifidus muscles, which are these little tiny muscles just along the spine that help support the bones, the joints, the discs. And so if those muscles get weak, then that can cause a lot of what's called mechanical back pain, meaning back pain when you do things, and less back pain when you don't do things. And so you have to basically exercise to help support these muscles. If that's not enough, there is a new therapy called Reactivate, which is a device that goes in there specifically to strengthen the back muscles, to help maintain that muscle tone, maintain the ability of those muscles to support your body as you're going through this weight loss process. And so if you're using these GLP-1 medications, you're losing all this body weight, which is fantastic for longevity, which is fantastic for your health going forward. It is just as important to help to continue to support your back muscles as you go through this process, so you don't lose too much muscle mass. And so keys are nutrition, exercise, and if exercise is not enough, there are new therapies such as Reactivate, which are designed to help strengthen the back muscles and to help you continue to be active and live a fulfilled life. So thank you for following along, and check out my other videos to check out to see what else is available for chronic pain, especially chronic spine pain. Have a good day.